Hello friends, welcome back to Complete Medical Coding. Today I am here with some anatomical questions which have been asked in the CPC examination, this year 2025. So as along with other chapters, even anatomy is also important. So let's discuss few anatomical questions, some important anatomical questions and some medical terminologies today. Okay friends. So friends, if you are new to the channel, please subscribe and let's move to the first question. First question. Which disease causes paralysis of the facial nerve? Which disease causes paralysis of the facial nerve? Option A, Bell's palsy. Option B, Guillain-Barré syndrome. Option C, ALS, which means amyotrophic lateral sclerosis. And option D, multiple sclerosis. What will be the answer? Facial nerve paralysis. That is, answer is option A, Bell's palsy. Okay. Let's discuss what are the other options. What are the other medical terminologies? What is Guillain-Barré syndrome? This autoimmune disorder causes the body's immune system to attack the peripheral nerves, resulting in muscle weakness that can progress to paralysis. So, muscle weakness. Okay. What is ALS? Amyotrophic lateral sclerosis. ALS is a progressive neurodegenerative disease that damages motor neurons, leading to muscle weakness and eventually paralysis. So, all these are leading to muscle weakness and paralysis. Okay. What is multiple sclerosis? This autoimmune disease attacks the myelin sheath, the protective coating of nerve fibers, leading to a range of symptoms, including muscle weakness and paralysis. So, facial nerve paralysis is Bell's palsy. What is Guillain-Barré syndrome? Again, all these are paralysis only. It will result in paralysis. But Guillain-Barré syndrome, where it is attacked? Peripheral nerves. ALS attacks. It's a neurodegenerative disease that attacks or that damages motor neurons. Multiple sclerosis attacks the myelin sheath. Okay. Second question. What is paraparesis? Paraparesis. Options. Option A, paralysis of one side of the body. Option B, weakness of one side of the body. Option C, partial paralysis of the lower extremities. And option D, paralysis of the lower extremities. So, paraparesis means, here the answer is option C, partial paralysis of the lower extremities. Okay. Moving to the third question. What is the name of the condition characterized by the presence of a persistent cough and mucus production? What is the condition which is called as the persistent cough and mucus production? Options. Option A, pneumonia. Option B, asthma. Option C, emphysema. And option D, bronchitis. So, persistent cough and mucus production, that is called, answer is option D, bronchitis. Okay, here the answer is bronchitis. Let's look into the other options also. What will be the conditions that causes these other three diseases? Pneumonia. Pneumonia, it's a lung infection often caused by bacteria, viruses or fungi that inflames the air sacs. The air sacs are called as alveoli. Okay, the air sacs in the lungs. So, inflammation of air sac, that is pneumonia. Asthma. It's a chronic inflammatory disease of the airway in the lungs, causing symptoms like shortness of breath, chest tightness, coughing and wheezing. What is emphysema? It's a long-term progressive lung condition characterized by damaged and enlarged air sacs in the lungs. Damaged and enlarged air sacs. Okay, emphysema. Fourth question. Who carries oxygenated blood to the heart? Yeah, this is an important one. What carries oxygenated blood to the heart? Options. Option A, aorta. Option B, pulmonary artery. Option C, pulmonary vein. And option D, femoropopliteal vein. Here the answer is option C, pulmonary vein. Okay, veins always carry oxygenated blood and arteries always carry deoxygenated blood. Keep in mind that. Okay. Fifth question. Which long bone makes the upper part of the arm? Upper part of the arm. Option A, humerus. Option B, radius. Option C, ulna. And option D, carpals. Here the bone, the long bone which makes upper part of the arm is, answer is option A, humerus. Okay. Moving to the sixth question. A pediatrician examines an adolescent that has a thoracic curvature of the spine. What is this condition called as? Thoracic curvature of the spine is called as option A, autism spectrum disorder. Option B, kyphosis. Option C, meningomyelocele. And option D, sickle cell disease. So the thoracic curvature of the spine is called as, answer is option B, kyphosis. Okay, kyphosis is called as, is the thoracic curvature of the spine. It is called as kyphosis. Let's look into the other options also, other medical terms also. What is autism spectrum disorder, which is also called as ASD? Autism spectrum disorder. It refers to a broad range of conditions characterized by challenges with social skills, repetitive behaviors, speech, and non-verbal communication. What is meningomyelocele? It's a birth defect affecting the spinal cord. Birth defect, okay, affecting the spinal cord. And what is sickle cell disease? Sickle cell disease, or most common sickle cell disease, is sickle cell anemia. Okay, it results in an abnormality in the oxygen carrying protein hemoglobin found in red blood cells. Abnormality in the oxygen that carrying the proteins, protein hemoglobin found in the RBCs. Okay. Seventh question. Sebaceous glands are a part of which anatomical system? This is also another important repeated question. Okay, sebaceous glands. Option A, respiratory system. Option B, cardiovascular system. Option C, nervous system. And option D, integumentary system. So, sebaceous gland is a part of hair. Okay. So, it is a part of which anatomical system? Answer is option D, integumentary system. Mostly it is in the hair. So, skin mainly. So, integumentary system. Eighth question. What is osteogenic? What do you mean by osteogenic? As you know, osteo, it means something which is related to bone. But what exactly the name osteogenic is? Option A, bone spur. Option B, fracture of a bone. Option C, originating in the muscle. And option D, originating in the bone. So, genic means, yes, generating, originating. So, here the answer is option D. Osteogenic means originating in the bone. Okay. Ninth question. What is the name of the condition where the body has an abnormal increase in fat? Abnormal increase in fat. Options. Option A, bulimia nervosa. Option B, obesity. Option C, cachexia. And option D, anorexia nervosa. As we know, abnormal increase in the fat means its answer is option B, obesity. Let's discuss the other terminologies as well. What is bulimia nervosa? Bulimia is an eating disorder in which a person has regular episodes of eating a very large amount of food. So, eating a very large amount of food is called as binging. Okay, during which a person feels a loss of control on eating. Loss of control on eating. That is bulimia nervosa. Now, what is cachexia? Cachexia, which is also known as wasting syndrome. It's a condition that causes significant weight loss and muscle loss. So, wasting syndrome. So, significant weight loss and muscle loss. That is called cachexia. And what is anorexia nervosa? Anorexia nervosa is an eating disorder characterized by restriction of food intake leading to low body weight, typically accompanied by intense fear of gaining weight and disturbed perception of body weight and image. Okay, restriction of food intake means less intake of food, very less intake of food, with the intention of fear of gaining weight. Okay, so that is called anorexia nervosa. Now let's discuss one more question, 10th question. What is anosmia? Anosmia. Option A, loss of taste. Option B, loss of vision. Option C, loss of smell. And option D, loss of hearing. Anosmia means answer is option C, loss of smell. Anosmia, smell, loss of smell. So what does other, what will be the terms for the other? Loss of taste, loss of vision, that we will check. What is loss of taste is called? Loss of taste is called ageusia. Loss of vision is called visual impairment or blindness. And loss of hearing, it's called hearing impairment or hearing loss. Severe hearing loss is called as deafness. Okay, otherwise it is called hearing impairment, but severe hearing loss is called as deafness. All right. So that's it for today. Hope you like the video. Hope this video is useful for you. If you find this video useful, please like and share it among your friends. Those, especially for those who are preparing for the examination, please like and share. And those who are new to the channel, please support me by subscribing to the channel. And thank you so much, friends. If you have any queries, please mark it. Please mention it in the comments. I'll be back again with more and more questions, practice questions, mostly the updated practice questions from this year. Okay, so stay tuned for more videos. Thank you so much and bye. Take care. See you soon.